Hi, welcome to another one of our Dr. Foot videos. I have a very busy day in clinic. I had a 20-minute gap, so I thought I'd make a quick video instead of going to get my coffee. So I'm sacrificing my coffee here. I wanted to make a quick video about a condition called Calcaneal Apophysitis. It's a mouthful. It's also called Sever's heel. I'm currently managing 4 teenage children. All 4 happen to be boys, and they're all complaining of the same condition. And I'm managing them, all 4 of them, quite differently. 3 of them are footballers, 1 of them plays rugby, and they're all very, very active. So what is calcaneal apophysitis? Calcaneal apophysitis is when the growth plate, which is at the back of the heel, becomes inflamed. Now the Achilles tendon attaches to the back of the heel. I'm going to try and put an x-ray up on the screen a bit later when I'm going to edit this video. Child complains of pain around the insertion of the Achilles tendon. It's not at the bottom of the heel where the plantar fascia is or the mid portion of the Achilles, but it's in a very specific location. We can do a couple of clinical tests like the squeeze test. I sometimes ultrasound it. I can see some changes at the insertion. X-rays are the best thing to get, or even an MRI scan to confirm the clinical diagnosis. That being said, I can usually confirm the clinical diagnosis in clinic by a couple of clinical tests and by palpation. This is quite difficult to manage, especially those children who are promising young footballers or rugby players that may get a contract very soon, or that are in academies. Obviously, the condition, well, I'm saying obviously, but the condition will go away on its own if you just rest it. But it's very difficult for these children to rest because they're so active. So the way I tend to manage it is I will give stretching and strengthening exercises, but I'll be very careful not to aggravate the Achilles and the actual growth plate. So I will choose the stretching and strengthening exercises appropriately. I will give an orthotic with a heel raise. So I'm really trying to lift up pressure from the Achilles and tendon and the insertion. Depending on the child, I may give varying levels of a heel raise, and I never just give it to one foot. So otherwise you'll get hip and knee problems in the other side if you just raise one side up. So we will raise up both sides. I may teach the child how to put K-tape on, just to alleviate the symptoms. You can ice sit after playing football or rugby. I may give orthotic sandals, so to put inside, to actually wear inside the house, so the child's not going barefooted too long. Now this condition resolves itself. It can sometimes resolve itself after a couple of months. Sometimes it can take up to a year, which is very difficult for both the child and the parent to accept. Because obviously it's not something that a child wants to rest from. If a child loves playing football or rugby, they don't want to rest for a long time. We can normally manage it with a reduction in the type of activities. So if they're playing a match, I will ask the child to only play half the match, so play 45 minutes. I will ask them to rest afterwards, maybe use ibuprofen or some other anti-inflammatories. Ibuleave gel can help, I suppose, for symptoms, but ibuprofen can help if the child has it with food and has a recommended dosage that is on the back of the packet, or they can ask the GP for further details. Other things I may do, I may recommend different types of football shoes or running shoes, different types of school trainers. It really depends on the child. Now, the 4 children that I'm managing right now, which is quite a lot for me to manage, because I normally see 1 or 2 over the course of a couple of months. To manage 4 in one time can be quite difficult, mainly because not that of the condition itself, because we can manage the condition, but it's because they want to return back to sport so passionately, because they're really passionate about playing sport. So it's really about managing their rest periods, managing their activity, and really not to overdo it. which is the main thing really. Not to overdo it and allow it to heal. This is a condition that will get better on its own. It generally does. What we can do is manage the symptoms. There are other things I can do, and I haven't discussed it with these 4 children yet because I'm hoping that the conservative measures can work. We can do shockwave treatment, extracorporeal shockwave treatment on this. It can be very successful. It can hurt while you're having it done, so which is why that's a consideration to take into account. I hope this video is helpful. As I said, I've sacrificed my coffee time, so I hope it's helped a few parents and children out there, and I shall speak to you soon. Take care. Bye.